At age 20, I had my tubes tied, so I would not have children anymore. I actually got pregnant at 40. I was extremely shocked. I'm still in shock. My belly has continued to grow for the 3.5 years, but it does grow at super low rates. My breasts are tender. My mood swings are super bad. I could be crying 1 minute, happy the next. When I go to a doctor, they take a pregnancy test. Of course, it does not show up on either blood or urine. They have also given me ultrasounds. They tell me all of negative. The doctors are wrong. I don't care what medical degree they have. I am 1,000% certain that I am pregnant. The movement in my stomach is what I'm saying is real. I know 1,000% I am giving birth to multiples. I think I'm carrying 6 babies. I could not believe how many heartbeats I'm getting in my belly. That is the most overwhelming thing that anyone can go through, especially if their tubes are tied. My family does not believe I'm pregnant. It has torn my family apart. This is the hardest thing I've ever experienced in my life. It's real and it's misery. I am sick and tired of being pregnant. I just want them out. I'm done with this. I'm done with pregnancy. I don't want it anymore, I'm done.
Okay, now, would you agree that this is unusual?
This is very unusual,
Okay.
very unusual.
I have to say, I'm the most non-judgmental, open-minded person I've ever met. Maybe not, but I really approach every situation like, hell, anything's possible.
Right.
Are you approaching this conversation with the possibility that you could be wrong?
1,000% I know I'm pregnant.
Well, there's really nothing for us to talk about then.
Okay.
Right, because I mean, you don't even entertain an alternative explanation.
Well, there's anything, I could have a tumor or something going on with me that I don't know about.
Right, that's what I mean. That's a possibility.
It is very possible. I don't know exactly what's going on.
And I'm not asking you to abandon your belief.
No.
You completely, totally believe that you're pregnant.
I do.
And you have a lot of reasons to believe you're pregnant. You say that your breasts have been tender, your belly, you certainly look. I mean, I wouldn't walk up and say you look pregnant. On the street, I might get slapped if you weren't. But your belly moves, you say?
Yes, it does. Would you like to feel it? If
No.
It moves? No.
No. You say that you have a home fetal Doppler and that you hear not just a heartbeat, but 6 heartbeats?
That is correct.
So you went to the doctor,
Yes.
but you knew you'd had your tubes tied, so did you go in there and say, what's going on?
Yes.
I can't be pregnant here.
Yeah, exactly.
And were you relieved when they said you're not?
Yeah, I was actually. I was very relieved. But then as the time goes on, like a year down the road, 6 months down the road, I still feel the tightening. And it was as the time goes on, the tightening got more up around my ribs, so it was hard to breathe.
But you've had ultrasounds, right?
Yes, but due to the ultrasound is a 15 megahertz and on the machines, and normally the Dopplers are like 3 to 5 megahertz. So if it's a too high of a megahertz, sometimes it will not pick up.
I do believe my anatomy is totally different. I know when I'm in the bed with my man that I have many parts down there. I don't just have one vagina, I have more than one vagina, and I probably have more than one uterus too. I cannot prove that because I am not legal to read CAT scans. I have a right one, a left one, and a back left one. It's different down there.
You examined Zona, correct?
I did.
Did you notice anything unusual about her anatomy?
No, her anatomy is completely normal.
Were there multiple uterus?
No. And I might miss a lot of things in my life, but I don't miss extra vaginas, or that wonon't happen.
Yeah, I would think.
My concern is why are there that many heartbeats in me that the Doppler is picking up?
Okay, what about these fetal monitors?
So first of all, you can, even if you carry one baby, I can put that Doppler anywhere in the abdominal area and I would pick up a heartbeat. For us as physicians, when someone's pregnant with multiple, 4, I've done quadruplets, I would never use a Doppler. I would actually use an ultrasound to locate the actual heartbeats on ultrasound. But you need to have a baby to pick up a Doppler. She was not, we had her bring her Doppler to my office, and she was not able to reproduce, you know.
I did 3 heartbeats in your office, and why didn't you use the regular ultrasound Doppler instead of using mine? It was right there.
Ultrasound Doppler works when there's a fetus inside.
Okay, why didn't you use it to see?
I couldn't find a baby.
If you're using technology against technology, why didn't, if this is really something to understand cryptic pregnancy or whatever this pregnancy is called, why didn't you as a doctor use your equipment to do this?
When I see an empty uterus, I don't look for babies anymore. Babies grow inside the uterus.
Confirmation bias is when people are only seeking out information that supports one's beliefs while ignoring any evidence that contradicts. That's called confirmation bias, okay? Think about what that says. You believe something, so you're biased towards your belief. And so you only seek information that supports your belief, and you reject anything or ignore anything that contradicts it. Is it possible that you suffer from confirmation bias?
It could be possible, but I don't think so.
Yeah, well, you wouldn't think so if you had confirmation bias, because you, I mean, right? If you had confirmation bias, you wouldn't think so.
No, I know 1,000% I'm pregnant, and I know 1,000% it does not seem real.
You know 1,000% what you believe.
No, I know 1,000%.
No, talk to me. This isn't an election. They're not going to vote.
I know 1,000% that I'm pregnant only because the fetal Doppler.
This is a perfect example of what I'm talking about. You have a lot of evidence that contradicts that, and you reject it and hang on to one thing that you believe. That's a perfect example of confirmation bias.
Because of that one information is a very, very, very important information on pregnancy. When you go to the doctor and you are a woman and you've never heard that baby before, what do when you're about 12 weeks pregnant? They're gonna let you listen to your baby's heartbeat. And for 1,000%, I know I am pregnant and have more than one child in me.
No, you don't know that, you believe that. You cannot confirm that, you cannot offer any evidence, but you just have a belief. That's right, but when you do see a doctor, in fact, one that has delivered 8,000 babies and they tell you otherwise, then you reject that and say, I'm gonna believe what I read on the internet and bought down to drugstore.
We're at the doctor's office where I'm gonna get my ultrasound and my exam.
Today, I'm gonna take a full history, do a complete physical exam, and do an ultrasound in order to find out if these women are pregnant.
What I'm hoping to learn today is that one day, cryptic pregnancy won't be a mental case. It's real.
Hi, Shayna. How are you?
Fine.
I'm Dr. Alia Badi.
I'm Shayna. Nice to meet you.
All right, Shayna. Let's start your ultrasound. Are you comfortable?
Yeah.
Oh, I'm gonna be done in a minute.
I'm just glad that you're taking the time to do this and to help. It's emotional, and it shouldn't be, you know? It's a blessing, not a bad thing.
This is my Doppler, and this is the only thing that I have to make sure the baby's okay, hear the heartbeat. It's the only thing that keeps me sane.
Is this where you usually find it?
Depending on how I'm laying.
Okay. No luck today, huh?
No.
There's babies in here, and I know for a fact. There it is. I barely hear it.
Bam, 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 bam. Bam, 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 bam. But I don't hear it. That's what I'm trying to check.
I know. There's babies in here. I got a Doppler. I know there's babies.
Do you
Sounds
have any
good.
questions for me?
I'm disappointed in the exam, and I don't think you're thorough enough, and that's just my opinion.
Okay. In addition to the exam, you also did lab work, correct?
I did.
Let's talk about Shayna.
So her blood pregnancy test was negative. Her hemoglobin A1C, which tells us about her blood sugar in the past 3 months, was very elevated. She's 0.1 away from being diabetic, which explains her weight gain. 6% of patients suffer from a condition called polycystic ovarian syndrome, or PCOS, and that's exactly what Shayna has. These patients usually have insulin resistance, which make them gain weight. They have elevated insulin, which stimulates testosterone or androgen, which is a male hormone production, which can cause irregular periods. So when these patients don't get their period or their periods become irregular and they're gaining weight, the first thing they think is pregnancy.
What do you think about what she's saying?
I don't think I'm sorry, but I don't think she did the ultrasound, looked for a baby. I don't think she looked for a baby, just like all the other ultrasounds that I had.
In 2016, I started to have symptoms that I thought could be related to pregnancy. I had frequent urination, sore breast, and sleep issues. At like 9 to 10 weeks, my belly started to pooch out. I did feel movement in my stomach. I took several home pregnancy tests. The results were negative. I thought the tests were wrong. I was 2,000% convinced I was pregnant. I took pictures of my belly as it was growing. I wanted to document my third child's growth.
I felt right.
I went online and became an advocate for cryptic pregnancies.
Give you guys a belly shot here, because there's no arguing with this belly.
I believed I was pregnant for 5 consecutive months until I got an ultrasound. The ultrasound was negative. Accepting that I was not actually pregnant was a process. I had to continually tell myself, I am not pregnant, my uterus is empty, in order for me to finally accept that there was no baby growing in there. Looking back at it, my mind convinced my body that I was pregnant. After I realized I wasn't pregnant, I literally felt my stomach deflate.
And as you can see, my belly is gone.
I feel for you women, I really do. My heart goes out to you because I've been there. I know the confusion and the uncertainty that comes along with reading about something like this.
My stomach's moving right now.
Mm-hmm.
Did you ever use a Doppler?
I did.
Yeah.
And once you changed your lifestyle, your diet, and your thought patterns, what happened to your stomach? Because you had a belly there that looked very prominent.
The only way I can describe it is that it deflated. It felt like it deflated.
Is there anything, any examination, any ultrasound, any test, anything that a qualified physician could do that hasn't been done that would clarify for you without question whether you're pregnant or not?
The ultrasound with a Doppler.
And if the ultrasound and the Doppler was negative, no heartbeat there, where would you come down?
I know there's going to be a heartbeat, so I don't know.
I will ask Dr. Ali Abadi to do that with you, but you have to agree, and I'm saying write it down and agree. If this is done and it comes back negative, then I will accept and pursue an alternative explanation.
Then I will accept and pursue an alternative explanation.
I ask you the same question.
I honestly think that due to a Doppler on a big machine, being that it is a 15 megahertz instead of a 3 to 5 megahertz, that it may not pick up because it's too powerful. Now, I know that doesn't make any sense, but I know in the medical, and I know a little bit about medical, so no, I'm just gonna see how it plays out.
I think you want to believe this.
I don't want
think
to.
you're getting a lot of currency out of it.
No.
Your daughter thinks you're doing it for
Currency.
attention, and
Oh,
so,
yeah? Okay.
right? Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.